The Complete Anxiety Recovery Guide. Everything you need to know opening. Welcome to the Complete Anxiety Deep Dive. If you've watched our main anxiety breakthrough video, you're ready for comprehensive information covering every aspect of anxiety from causes to complete recovery. We'll explore 10 detailed areas with the latest medical research and practical guidance for lasting wellness and freedom from anxiety. Progression and health impact. Without treatment, anxiety typically follows a progressive pattern that can significantly impact overall health and quality of life. Initially, symptoms may be mild worry and occasional physical tension, but they often expand to affect cognitive function, physical health, and social relationships over time. The condition can evolve from situational worry to persistent generalized anxiety that permeates work performance, relationships, and basic daily functioning. The physical health impact extends far beyond mental symptoms, as anxiety triggers chronic stress hormone release and inflammatory responses. This prolonged physiological activation can contribute to cardiovascular disease, digestive disorders, autoimmune conditions, and chronic pain syndromes. Anxiety increases the risk for heart disease by 48%, as well as the risk of stroke, diabetes, and premature death, making early intervention crucial for preventing these serious complications. However, understanding progression also reveals hope for intervention at any stage. Even long-standing severe anxiety responds well to modern treatments, and the brain's neuroplasticity allows for significant improvement regardless of how long symptoms have persisted. Modern treatments can interrupt the progression and often reverse many of the negative impacts, restoring normal stress response and well-being within 2-4 months of beginning appropriate care. Underlying causes and risk factors. Anxiety results from a complex interplay of genetic, neurobiological, environmental, and psychological factors, with no single cause responsible for development. Genetic predisposition plays a significant role, with family history increasing risk by 4-6 times, but having anxious relatives does not guarantee developing the condition. Neurotransmitter system differences, particularly involving GABA, serotonin, and norepinephrine pathways, contribute to increased anxiety sensitivity. Environmental factors include childhood trauma, chronic stress, major life transitions, medical illnesses, and caffeine or substance use. People who have experienced abuse, neglect, or unpredictable environments are more likely to develop anxiety disorders. However, many people with these risk factors never develop anxiety, while others with fewer risk factors do, emphasizing the individual nature of the condition. Psychological factors encompass perfectionism, need for control, negative thinking patterns, and learned avoidance behaviors. Physical health conditions, hormonal changes, medication side effects, and sleep deprivation can also trigger or worsen anxiety symptoms. Understanding these multifaceted causes helps eliminate self-blame and emphasizes that anxiety is a legitimate medical condition requiring professional treatment. Diagnosis and assessment. Professional diagnosis involves a comprehensive evaluation that considers symptoms, medical history, and functional impairment in daily life. Mental health professionals use standardized diagnostic criteria from the DSM-5 and assessment tools like the JD-7, Beck Anxiety Inventory, or Hamilton Anxiety Rating Scale to ensure accurate identification and rule out other conditions with similar symptoms. The process typically includes detailed interviews about symptom patterns, triggers, duration, and impact on work, relationships, and daily functioning. Physical examinations and sometimes laboratory tests help rule out medical conditions that can mimic anxiety symptoms, such as thyroid disorders, heart conditions, or medication side effects. Many people feel relieved during the diagnostic process because it validates their experiences and provides a clear path forward for treatment. Healthcare providers emphasize the collaborative nature of diagnosis, encouraging patients to openly discuss all symptoms without fear of judgment. The diagnostic process also identifies any co-occurring conditions like depression, PTSD, or substance use disorders, which affects treatment planning and approach. Modern diagnostic frameworks recognize the complexity of anxiety presentations and focus on functional impairment rather than symptom severity alone. This comprehensive approach ensures that treatment addresses all aspects of the condition and maximizes the likelihood of successful recovery. Key questions to get the best treatment and outcome. Engaging actively with healthcare providers through thoughtful questions ensures optimal treatment outcomes, and builds collaborative therapeutic relationships. Essential questions include asking about different treatment options available, expected timelines for improvement, and specific criteria for measuring progress. Inquire about combination treatments, such as medication plus cognitive behavioral therapy, and whether newer treatments like neurofeedback or VR therapy might be appropriate for your specific situation. Discuss potential side effects of recommended treatments, strategies for managing them, and what to do if initial treatments don't provide sufficient relief after 8-12 weeks. Ask about lifestyle modifications that can enhance treatment effectiveness, including exercise, sleep hygiene, and stress management techniques. Understanding the provider's experience with your specific type of anxiety and their approach to treatment planning helps build confidence in the therapeutic process. Important questions also include discussing warning signs that would require immediate medical attention, how to access crisis support between appointments, and involving family members or support persons in treatment. Ask about long-term prognosis, strategies for preventing relapse, and transitioning from active treatment to maintenance care. Inquire about genetic testing for medication selection and whether your anxiety might benefit from specialized treatments like EMDR or stellate ganglion blocks. Medications and their effects. Modern anxiety medications offer effective symptom relief with improved safety profiles compared to earlier treatments. SSRIs like sertraline, escitalopram, and paroxetine remain first-line treatments, typically requiring 4-6 weeks for full effectiveness while producing fewer side effects than older benzodiazepines. These medications work by increasing serotonin availability in brain synapses to improve mood regulation and reduce anxiety sensitivity. Newer medications show promise for rapid relief. Zuranolone induces anti-anxiety effects within 48 hours and is FDA approved for severe anxiety, avoiding the delayed onset that previously left patients suffering for weeks. Benzodiazepines may be prescribed for short-term relief while SSRIs take effect, though these require careful monitoring to prevent dependence and withdrawal issues. Medication effectiveness varies significantly between individuals, often requiring adjustments in dosage or switching between different classes to find optimal results. Most people experience substantial improvement within 6-8 weeks of starting appropriate medication. Side effects, when they occur, are typically mild and temporary, including initial nausea, drowsiness, or changes in appetite that resolve as the body adjusts to treatment. Holistic and complementary approaches, integrative treatment approaches combining conventional medicine with evidence-based complementary therapies, show enhanced effectiveness for anxiety recovery. Recent studies prove that regular aerobic exercise can reduce anxiety symptoms by 40-50% through endorphin release, GABA enhancement, and stress hormone regulation. Regular cardiovascular exercise, particularly yoga or swimming, produces powerful anxiety-reducing effects by activating the parasympathetic nervous system. Mindfulness-based interventions provide practical tools for managing worry and panic while building long-term emotional resilience. Cognitive behavioral therapy, combined with mindfulness, shows significant benefits for preventing anxiety recurrence, particularly when combined with medication management. Nutritional modifications, including magnesium supplementation, reducing caffeine intake, and stabilizing blood sugar, support overall nervous system health and may enhance treatment effectiveness. Community support approaches have proven incredibly effective in providing social connection and accountability that people with anxiety often desperately need. These approaches recognize that healing encompasses the whole person, not just symptom reduction. The combination of traditional and complementary treatments often produces better outcomes than either approach alone, offering multiple pathways to recovery and long-term wellness. OTC items that can be of help. Several over-the-counter supplements can provide supportive benefits for anxiety management when used alongside professional treatment. Magnesium helps regulate nervous system function and muscle relaxation, particularly beneficial for people experiencing physical tension or sleep disturbances. L-theanine and GABA supplements show promise for acute anxiety relief through direct neurotransmitter support. Ashwagandha and passion flower show promise for generalized anxiety through stress hormone regulation and nervous system calming. Research suggests that omega-3 fatty acids play a direct role in brain inflammation reduction and neurotransmitter production, supporting the use of fish oil supplements. Valerian root and chamomile have mild sedating effects for some people, though these should be discussed with healthcare providers to avoid interactions with prescription medications. Aromatherapy products like lavender essential oil can provide immediate calming effects during panic episodes or high-stress situations. These supportive measures work best as part of comprehensive treatment plans rather than standalone solutions for moderate to severe anxiety. Self-help strategies. Empowering self-help strategies provide immediate tools for managing anxiety while building long-term resilience and recovery skills. Deep breathing techniques quickly activate the parasympathetic nervous system and can be used anywhere anxiety symptoms arise. Progressive muscle relaxation helps identify and release physical tension that often accompanies anxious thoughts. Cognitive behavioral techniques include thought challenging, behavioral experiments, and graded exposure that bring measurable relief. Creating structured daily routines provides stability and predictability that reduces uncertainty and anticipatory anxiety. Regular sleep hygiene, consistent meal times, and scheduled relaxation time support overall nervous system regulation. Gradual exposure to feared situations help overcome avoidance behaviors that maintain anxiety disorders. Keeping anxiety and trigger journals helps identify patterns and successful coping strategies. Building social connections and maintaining meaningful activities prevent isolation and provide natural anxiety-reducing experiences. These strategies complement professional treatment and provide sustainable tools for long-term anxiety management. Supporting loved ones. Supporting someone with anxiety requires understanding, patience, and knowledge about effective approaches that truly help rather than inadvertently increasing worry or avoidance. Listen without judgment and avoid minimizing statements like "just relax" or "stop worrying," as this invalidates their experience and can increase shame. Instead, acknowledge their struggle and ask how you can best provide support during anxious moments. Learn about their specific triggers and symptoms and respect their need for accommodations while encouraging gradual progress rather than demanding immediate confrontation of fears. Offer practical support like helping with avoided tasks, providing transportation to appointments, or simply staying calm during their anxiety episodes. Encourage professional treatment while avoiding becoming their primary reassurance provider or enabling avoidance behaviors. Maintain your own well-being and set healthy boundaries to prevent caregiver burnout and codependency. Support groups for family members and friends of people with anxiety provide valuable resources and connection with others in similar situations. Celebrate small victories and progress, understanding that recovery often involves facing fears gradually rather than dramatic breakthroughs. Prevention strategies. Building resilience and implementing prevention strategies can significantly reduce anxiety risk and prevent symptom recurrence in people with previous episodes. Regular stress management practices, mindfulness training, and maintaining work-life balance create a foundation for emotional stability and stress resilience. Developing healthy coping skills early helps people navigate life stressors without developing maladaptive worry patterns. Maintaining social connections, setting realistic expectations, and practicing self-compassion provides natural buffers against perfectionism and catastrophic thinking that can trigger anxiety. Learning to identify and address early warning signs before they become entrenched prevents the development of avoidance patterns that maintain anxiety disorders. Regular mental health check-ins and maintaining therapy relationships help prevent symptom escalation. Early intervention during adolescence and young adulthood, when anxiety often begins, can prevent progression to more severe or chronic conditions. Education about anxiety helps people recognize normal stress versus clinical anxiety and seek help promptly. Building emotional regulation skills, stress tolerance, and problem-solving abilities enhances protective factors and reduces vulnerability to anxiety triggers. These prevention strategies benefit everyone, regardless of anxiety history, by promoting overall wellness and resilience. Subscribe now to join thousands getting reliable health information that improves lives, as knowledge is your best medicine, and we hope you've gained valuable insights from this video series. Make sure to subscribe and like this video. It helps us create even more valuable health tips for you and others. Don't forget to share with anyone who would find this useful. Also, please comment below with any questions or topics you'd like us to cover next. Stay informed, stay healthy,